I'll be giving a summary of how biomarkers are being currently applied in acute graft-versus-host disease, and then also giving an update on chronic graft-versus-host disease biomarkers, which is the area that I work in. There's been some really exciting advances and progress, although nothing is still is yet ready for clinical application. I'll also be summarizing particularly the work that we have done in children. We have a large network called the ABLE Network, Applied Biomarkers Late Effects, which is includes 26 centers. And that effort has really resulted in a lot of rich data that we hope to develop into biomarkers we can apply in chronic graft-versus-host disease in the next 2 to 3 years. In acute graft-versus-host disease, I think it's well established that the work by the MAGIC group, there are really two. One is REG3 alpha and the other is ST2. And there are certain proportions used in that, and that's being applied. In chronic graft-versus-host disease, it is very complex disease. And so what we have done in developing an algorithm for chronic graft-versus-host disease is a combination of markers. This includes cell markers, it includes clinical markers, it includes metabolomic markers, and even some cytokine markers. And it's a complex algorithm that we've had to develop involving over almost 20 different biomarkers put together. We're in the process of validating the biomarker algorithm, which will be predictive for the development of GvHD. So it's designed to be done at 3 months after transplant, which will place patients into low, medium, or high-risk groups. If we're successful in validating this combination biomarker algorithm, we should be able to take patients who are in the high-risk group and give preemptive therapies to try and minimize the development of chronic graft-versus-host disease before they ever develop it. At the same time, a group in the patients in the low-risk group, which is 50% of the children, we will be able to potentially minimize the amount of immune suppression that they receive.